Hi guys, hope y'all been enjoying. Thanks for posting comments and whatnot and following our bark page and helping us out with best of the best and different things like that. Today what we're going to talk about is when we have debridements. So what debridement is usually when you're dealing with, we'll talk about toes because I see a lot of dog toes and cat toes. What debridement is, particularly this time of year in the spring, summer, when we get a lot more growth, we get a lot more stickers here in the El Paso areas, from foxtails to goat heads, depending on where you're at in town, where you walk your dog, where you go. Sometimes you have a bigger problem than other people. So what we'll see, particularly in our fuzzy breeds, but it can happen in any of them, and I see them commonly in our pit bulls, chihuahuas, and all our domestic short hair cats. But you know, they'll walk and they'll get a sticker, and then that sticker just works its way in between the toes and it'll fester a little bit. A lot of times we can kind of manage it with secondary antibiotics, we can manage it with some inflammatory medications, and the body will wall it off and it'll fester its way out, and then we'll get it out. I do soak some of these guys in Epsom salt a little bit, and then we do have some medical grade honey that works really well as well. So watch out for those guys when y'all are walking your puppy dogs or your cats. They do like to get little infections in there. And when we're going in for surgical debridement, basically what that means is we've had medical failure, is a way of thinking about it. So medicine did not work, therefore we're gonna go the surgical route. So what we do is we go in and we literally debride, or kind of cut out around that tissue and pull it out. Because when you have a foreign material or a foreign body, in this case, a foxtail, a goat head, the body tries to fight it and wall it off. Sometimes it'll just make a little cyst and that'll be it. And other times the body will push it on out. Other times it just festers and you get this draining tract, so pus, infection, bacteria coming from that source, and the only way to get rid of it is go in surgically and cut it out. So we do that a little bit. We have done a few of those here recently. So wanted to share that with you guys, and watch out for that and keep an eye on it. It does not help them when they're licking it all the time. Then they're taking all that infection in their mouth and introducing it to an open sore. And sometimes that's how these propagate and grow a little bit and just be this intermittent reoccurring annoyance more than anything. Very rarely is it life-threatening or anything super crazy. But there are some crazy clinical cases that specialists have put out where they get a foxtail in their toes and it migrates all the way into their lungs, and they've gone in surgically and gotten them out and identified those through CT scans and other fancy diagnostics. So very rare, doesn't happen often, but it does happen. So be careful, watch for it guys, and you all be safe. Bye.